Unfortunately, Cal-OSHA has given the hospitals a pass until supplies can be obtained. So, again, this is the University of California. This is California. We need to do better. We already have had many healthcare workers in this nation die, and more are infected. And I think we need to do better to protect our frontline healthcare workers.
And so they knew the whole time, and really, they've done nothing about it. And now, when nurses and doctors and others are desperately trying to protect themselves, as well as protect their families and their communities and their patients who may not have COVID yet, and they're, taking to social media and putting pictures of themselves wearing garbage bags because there's no gowns available, or actually refusing to treat patients until they have some minimum of PPE for themselves, they're getting suspended and fired from their jobs. So, we need real leadership here, and it doesn't appear that, the Trump administration or the CDC is prepared to give it. And ultimately, what this really shows, what this whole pandemic brings into stark relief, is that the system is totally broken. The for-profit healthcare system, it was already broken before this pandemic started. You had thousands of people dying because they don't have health insurance, and now it's even more clear that you cannot make profit off of keeping people well. It's just completely, fundamentally incompatible.
Hi, I'm speaking today for a nurse that's working. Her name is Jamil Kabakungan. She's a nurse at UCSF Parnassus. So this is her statement. As a nurse that directly cares for patients with suspected and confirmed COVID-19 patients, I am honored to be by my patients' side. They are in true isolation from their family and community, so I take my time in making sure they are medically stable, are cleaned up, and are up eating their meals and resting comfortably. I'm proud to do this work, but I'm doing it without the highest standards of protection. Unfortunately, UCSF has enforced a policy that only allows me to wear a surgical mask when working with COVID patients during non-aerosolizing procedures. This is not full protection. I need an N95 mask respirator that creates a seal around my face and filters 95% of air particles every time I go into my patient's room. I do not want to get infected nor spread COVID-19 to those around me. It is heartbreaking to be a frontline healthcare worker and feel disposable by my employer. My colleagues and I have other patients to care for and families to go home to. We should not be risking our lives when we are needed the most during this pandemic. UCSF, follow the Cal-OSHA aerosol transmissible disease standard. Give us the N95 masks immediately for every shift, for every worker that goes into the rooms of potential or actual COVID-19 patients. We urge you to keep our nurses, nurse assistants, hospitality workers, therapists, and doctors safe. We are all here to protect lives. Be on our side.
My name is Andrew Castro. I'm a registered nurse in the neurological ICU at UCSF's Parnassus campus. I have 6 years experience as a nurse and I've worked at UCSF for 2 years. I'm here to condemn the unsafe practices of reusing PPE, such as face shields and N95 respirators, that my hospital is requiring us to do as we take care of our patients with coronavirus. UCSF is making us put our health and lives at risk by having us reuse important equipment that protects us from infectious diseases like the coronavirus. Under normal circumstances, this practice would be completely unacceptable, and it's because it's a substandard practice. And to be clear, it is still completely unacceptable. These masks and face shields are meant for one-time use, and the fact that we are reusing dirty supplies contradicts the very basic principles of infection prevention that all nurses are taught in their schooling. Nurses on my unit are appalled that the hospital administrators and managers are telling us to reuse this equipment, and it makes us all concerned for our own safety. With the support of our union, nurses on my unit are speaking up to management, making it clear that these practices are unacceptable. We are documenting unsafe working conditions regularly. I want to make one thing very clear, that UCSF is obligated to uphold the highest standards of protection for all our nurses and sanitation workers that take care of our patients with coronavirus, and we demand that they do so now.
Yeah, so my name is Neil. I'm a human rights lawyer. I'm a postdoc and a head steward in UAW 5810. I'm here for 12,000 postdocs and academic researchers across the UC because we respect our healthcare workers. We respect our frontline nurses, our doctors, everyone who's interacting with patients and interacting with the family and friends of patients. And we don't think it's too much to ask that everyone else do the same. They're putting their lives at risk to keep our lives safe. And all that we believe that they should have is their right to a safe workplace environment.
Right.
So we are standing here with them, as represented by me. And we hope that others are going to do the same until our frontline healthcare workers can get back to work keeping us safe, and whether it's in COVID, whether it's in anything else, able to work in an environment where they feel safe doing it.
Erin Brightwell from UPTE.
I'm a speech pathologist at San Francisco General Hospital. I work for UC. I want to thank CNA, the nurses union, for organizing this very important protest and all the protests that they've been organizing, because it's abundantly clear that our so-called leaders have abandoned working people, from patients to frontline workers, whether they're nurses, grocery workers, delivery drivers, or bus drivers. And we're stuck out here trying to make the best that we can with insufficient supplies, at risk of contracting a virus that is killing people by the thousands. You know, I don't think anyone is really under this impression, but if anyone out there is under the impression that we didn't know in time, they couldn't have known how bad this was going to be. Well, that's not true. Last year, the Trump administration itself did a model of how bad an influenza epidemic could be in this country. They found all kinds of scary conclusions. They knew that they would have to be pushing PPE out to the states, and they sat on it. They didn't do anything with that. So they knew a year ago this, and they knew really long before that, but they knew a year ago from the Trump administration itself that it could be this bad, and they did nothing. And then they saw what happened when the first wave hit in China, and you know, who knows how many healthcare workers became sick, but it was probably in the thousands, and dozens died, and they did nothing. And then we lost even more precious weeks when we saw what was happening in Italy, and more healthcare workers were getting sick and dying. What we really need now is we need to nationalize and run not-for-profit the entire healthcare system, including the medical supply chain that makes the PPE that nurses and all the frontline workers need to keep themselves and their communities and their patients safe. So again, I want to thank CNA for stepping up here and for showing the world that nurses can run the hospitals.
Yeah.
If nurses are given, if we understand the science, then the frontline workers, they can run the hospitals a whole lot better than the administrations can. So thank you, CNA.
My name is Dr. Anish Nanam. I'm the Regional Vice President for Committee of Interns and Residents, or CIR. CIR represents all the resident physicians and fellows that work at UCSF, San Francisco General, and the VA. I'm here because CIR stands with CNA nurses and other healthcare workers here at UCSF. We support the demands for adequate personal protective equipment and safe staffing here in the hospitals. We're all committed to serving the community through this crisis. We accept the sacrifices that we know that we're going to have to make for ourselves and our families in order to keep the community safe through the coronavirus pandemic. But it's only fair that we have the personal protective equipment that's necessary to do this job safely. We are heartbroken about the deaths of nurses and doctors and other healthcare workers across the country due to coronavirus, and we think that everything should be done to prevent these tragedies from happening, and people should expect to have a modicum of safety when they're at work. So UCSF should do more to provide adequate PPE for all of its workers here. But we also know that there isn't enough PPE, and that California and the federal government can do more to ensure that there's adequate PPE available. SEIU has called on Governor Newsom to use emergency powers to direct the state of California's production capacity to build more ventilators, and also to manufacture more PPE. This is the 5th largest economy in the world. If the federal government and Trump aren't going to do the right thing and actually step in and make sure people are safe, then the state should do something, and they can There's no reason to delay any further. So I stand with the nurses and the other workers here together at UC to ensure that everybody stays safe. UCSF and the state should do more. We all deserve better.
Thank you.
Thank you. Maureen Dugan.
And why is Cal-OSHA, have they investigated, have they been investigating the health and safety dangers?
I don't know. They've just, as one of our speakers said, our leadership has been very disappointing. We've reached out to every regulatory agency, every legislator, international and national professional organizations, that we all need to do better. It's very frustrating. There's some areas that have been provided N95 masks. The bags illustrate that they have been told to reuse them, which is, again, not proper infection control policies, not proper standards. We've never had standards like, these are no standards. We've never done this before. Some areas are being denied. The dedicated COVID unit, the nurses have been denied N95s until just last night because of all our actions and all our support. But again, every hospital worker that comes in contact with potential, they call them persons under investigation or positive COVID patients, should be allowed the proper PPE, and that is not happening. Our nurses are standing up. We know better, and we are advocates for our patients and our communities, and of course ourselves and our other healthcare workers. So no, we are absolutely standing front and center to say, you need to do better. Please do not tell us this junk science that you're giving as an argument. We know this is airborne. There is actual research that shows it is airborne. We are being told not to worry and to just do as we're told, and we know better.
Are you possibly infecting other patients
That's
by
a huge
reusing
concern.
the mask?
That's a huge concern. We also know there's a tremendous amount of asymptomatic transmission, and again, that's why we're standing up for the standards that should have been in place from the beginning, the highest level of standards, not the lowest.
Which are Cal-OSHA standards.
Correct. Cal-OSHA aerosol transmissible disease standard.
But Governor Newsom, where does he stand on this? What's he said about this? Has he been asked?
He has been asked, and he's a politician, and I think he's trying to deal with this pandemic. We're working with him, but again, there's many facets. I know it's a very difficult situation, but again, you don't start this at the lowest level. You start with the highest level. And we know hospitals have the supplies. They're waiting for a surge. We can respect that, but we're doing well in California. You need to protect the people that are coming in contact, especially with a positive patient. A surgical mask that you can see on some people here today all day. That is one use that is really only good for 30 minutes. And you're telling a nurse that's coming in contact with potential COVID patients and actual COVID patients to wear that. That is absolutely ridiculous.
That's a threat to health and safety.
That is a threat to everyone's health and safety. Everyone's.
And what were the paper bags again? What do they represent?
They are told, nurses that are all, staff that is allowed to have an N95 are told to put them in a paper bag and save them for their entire shift and up to 5 days. It's not much better than wearing a paper surgical mask.
And you're just demanding more of those masks.
We're demanding the proper PPE for the proper situation. And again, we have a lot of patients coming in that are under investigation. We should have the utmost level of PPE for the patients we're seeing.
And how many of your members have been infected?
Well, the university's not giving us that information.
Shouldn't that be a requirement? Shouldn't they be required
the state's
to provide that
required, yes.
information?
We have a right to that information so we can protect our members. And again, nurses should not be infected. We should have the highest level, all healthcare workers should have the highest level of PPE. There's no reason that healthcare workers should be infected. We have been through this before. We've been through H1N1, we've been through SARS, we've been through Ebola. There's no reason that hospitals should have been behind the ball on this. No reason.
And Taiwan, South Korea, they protected their healthcare workers. Why is it in the United States we can't
We have a
protect
broken
our
healthcare system, and that's why California Nurses, National Nurses United are up front and center to get Medicare for all. And this is clearly showing the nation that our system is broken. It is broken, and people are suffering, and more deaths are happening and more disease is happening that could be prevented.
I'm Dea, I'm a registered nurse at UCSF, and I believe that all of us, for COVID patients, we should be having N95s that we can throw away. Also, we should not be just wearing surgical masks like this mask I wear. On top of the mask they give me, as you saw, the yellow mask, is what we have to wear for potentially rule out patients. And I believe that we should be given N95s all the time, just in case, because when I go home, if I have anything on me, that can potentially be taken home to my family. So we all need protection at work, so we're protecting not only ourselves, but other patients we care for, and also our families when we go home.
My name's Ashley Burnin, and I work in the float pool, which is a pool of nurses that go to whatever unit has staffing needs that day. So, you know, the conditions around the hospital are really appalling. Ultimately, people are scared and being forced to work with inadequate PPE, and they feel like they're exposing themselves. And, you know, we really want to be there for our patients, and we want to work the front lines, and we're proud to do the work that we're doing. It's just we need and expect the proper protection for ourselves so that we can prevent transmission amongst ourselves, our coworkers, our patients, but also so that we don't have to bring this potentially back to our families and our communities. So ultimately, you know, these simple surgical masks are not adequate protection, and ultimately it's still too early to tell what, you know, how this virus is actually transmitted. So we demand and expect the highest protection until more research is available, which may not be for several years. And ultimately it goes back to, you know, what Mo said, that we have a broken healthcare system where executives are profiting off of the well-being of our community members. And as long as we have a for-profit healthcare system, we will be fighting this battle over and over and over again. And until we can change, you know, either locally, statewide, or ultimately we need to change it nationally, we need our healthcare system to, you know, spend the money where it's required to protect our communities, and ultimately they cut corners to save money, and so that you know, money goes into the pockets of our executives. They're not taking any pay cuts, and you know, ultimately if our executives are saying that this proper protection, that this protection is enough, we'd like to see them working the front lines. We'd like to see our executives putting their money where their mouth is and going in those patient rooms, wearing the PPE that they're expecting us to wear, and caring for the patients that we are expected to care for. So if they truly believe that this is the proper standards, then they can prove it by coming into those rooms and exposing themselves, and not just requiring us to be the frontline workers and expose ourselves and our family members and our community members.
We're here in front of UCSF Medical Center. The California nurses did this major action today with respecting the social distancing, physical distance of 6 feet. I'm a medical interpreter, and I've been assigned to work remotely from now by video to treat our patients, to help treat our patients.
Why hasn't UC provided masks to workers who are working with the patients?
Well, that's basically the big question. Why they haven't provided masks? They haven't provided masks because they have defunded the public healthcare system for many, many years now. And a lot of the different healthcare systems have become subcontracted or privatized. And we have a healthcare system that's completely destroyed. It's been completely destroyed. Also, I would like to add that the fact that most people have their health care, if they have health care at all, they have it assigned by their job. And there's been about 17 million people that have applied for unemployment now. So there's 17 million people more people who, most of whom will probably not even have any health insurance to begin with. So this is a major national disaster. And Trump is now saying that he wants to open up on May 1st. And I believe Newsom also mentioned the same thing, that he wants to open up for business on May 1st. But in reality, it should be us workers who actually decide when it's safe, because obviously the government is not listening to to the experts on this, and the experts are the people who are the scientists who are seeing that there's surges, and it's very dangerous to pull back on these measures just when we're getting to the point of possibly flattening a curve, and it would be disastrous if we were to pull back now and not continue with these very measures. The problem, what I've seen happen in other countries, though, especially in Chile, for example, is that these partial measures that are being done by, for example, the Piñera government, where they have certain areas locked down and other areas no, is basically exacerbating the situation, because that doesn't protect the workers on the ground. Just like you see in many places here, even here in California, people are forced to go to work because they are essential workers. Farm workers are working, delivery people are working, and all of them are being exposed, and none of them are being protected. And I'm very disappointed, and specifically disappointed of the letter that was sent out by 4 major presidents of one of the 4 major unions in this country, by the American Federation of Teachers, by CWA president, by the SEIU president, and the Teamsters president as well. They were calling this a stress test of capitalism. This is not a stress test of capitalism. Stress tests, when you talk about stress tests, they're done under controlled environments. This is basically a complete failure of the capitalist system. It's a complete failure of the neoliberal system of privatization, and we need to not only change that, we need to radically change it. And that means we have to stop funding wars, we have to stop funding these private corporations and fossil fuel companies. And few people realize that this coronavirus came about because of the way that we are trespassing on the natural habitat and deforestation of the bats. And then it went on to the eating of certain animals and transmitted from the bats to other animal, and then to humans. A lot of these outbreaks are occurring precisely because we are not following ecological principles and sustainable principles, and that's also part of the whole thing. So it should come as no surprise. There's been many studies that have proven this, and also I would like to make out a call to support an end to the blockade against Cuba. Cuba has been at the forefront of fighting against major epidemics that have been going around worldwide. They've been sending doctors all over the world. They have a very robust pharmaceutical industry that's based not on profit models but on need, and including the interferon alpha 2B medicine, which has proven to be quite effective in conjunction with other medications, quite effective against the COVID-19, COVID-2. And unfortunately, Cuba has been subjected to 60 years of crippling economic blockade by the U.S. The U.S. has basically been behaving like a bully and has been basically stopping other countries from trying to stop other countries from having any kind of trade relations with Cuba, and penalizing them severely economically if they do have any kind of trade relations with Cuba. And in this case, it would behoove the American public to actually have full, complete medical cooperation and end the blockade with Cuba, because Cuba has actually shown itself to be very successful in treating this virus in their model of medicine.
Isn't it genocidal, like in Iran, Venezuela, to have blockade of
exactly, exactly.
What kind
None of those embargoes should happen. The U.S. just has no right to be doing any kind of medical embargoes or humanitarian or any kind of embargoes whatsoever, economic embargoes whatsoever. I was pointing out Cuba in particular because of Cuba's specific role in helping to defeat many disasters worldwide. But the whole embargo, the way that the U.S. has been doing it against people has been doing it. They did it against Iraq, and during 12 years, and which ended up killing 500,000 people. And Madeleine Albright said it was okay. So we also need to look out for people who are in prison, immigration detention centers, and homeless people as well. Those are areas which are of primary concern as well, besides healthcare workers.
My name is Andrew Castro. I'm a registered nurse in the neurological ICU at UCSF's Parnassus campus. I have 6 years experience as a nurse and I've worked at UCSF for 2 years. I'm here to condemn the unsafe practices of reusing PPE, such as face shields, N95 respirators, that my hospital is requiring us to do as we take care of our patients with coronavirus. UCSF is making us put our health and lives at risk by having us reuse important equipment that protects us from infectious diseases like the coronavirus. Under normal circumstances, this practice would be completely unacceptable, and it's because it's a substandard practice. And to be clear, it is still completely unacceptable. These masks and face shields are meant for one-time use, and the fact that we are reusing dirty supplies contradicts the very basic principles of infection prevention that all nurses are taught in their schooling. Nurses on my unit are appalled that the hospital administrators and managers are telling us to reuse this equipment, and it makes us all concerned for our own safety. With the support of our union, nurses on my unit are speaking up to management, making it clear that these practices are unacceptable. We are documenting unsafe working conditions regularly. I want to make one thing very clear, that UCSF is obligated to uphold the highest standards of protection for all our nurses and sanitation workers that take care of our patients with coronavirus, and we demand that they do so now. Now I'm going to speak in Spanish. Hola, me llamo Andrés Castro. Soy enfermero en la unidad neurológica intensiva en el hospital de Parnassus en UCSF. Tengo 6 años de ser enfermero y los últimos años 2 años en UCSF. Estoy aquí para condenar las prácticas inseguras de reutilizar el equipo de protección personal como las máscaras, protectores faciales y los respiradores N95 que el hospital nos exige usar cuando cuidamos a nuestros pacientes con coronavirus. UCSF pone en riesgo nuestra salud y nuestras vidas al hacernos reutilizar las mascarillas que nos protegen de enfermedades infecciosas como el coronavirus. En circunstancias normales, esta práctica sería completamente inaceptable porque es una práctica deficiente. Y para ser franco, esta práctica todavía es completamente inaceptable. Estas máscaras y protectores faciales están diseñados para un uso único, y el hecho de que estemos reutilizando suministros sucios contradice los principios básicos de prevención de infecciones que se enseñan a todos los enfermeros en su educación. Todos los enfermeros y enfermeras en mi unidad de neurológica intensiva estamos horrorizados de que los administradores y gerentes del hospital nos digan que sigamos esta práctica de reutilizar las mascarillas. Estas prácticas nos preocupan porque ponen en riesgo nuestra propia seguridad. Con el apoyo de nuestro sindicato, enfermeros de mi departamento están hablando con la gerencia, dejando en claro que estas prácticas son inaceptables. Estamos documentando condiciones de trabajo inseguras regularmente. Me gustaría hacer una cosa muy clara. UCSF está obligado a mantener los más altos estándares de protección para todos los enfermeros y todos los trabajadores sanitarios que cuidamos a nuestros pacientes con coronavirus, y exigimos que comiencen a hacerlo ahora. Gracias.
Thank you, Andrew. Your Spanish is way better than mine. Next, I want to introduce Ashley Vernon.
Hello, my name is Ashley Vernon, and I have been a nurse at UCSF Medical Center for almost 8 years. My job is to work on different units around our hospital, wherever there is staffing needs. So I work on and experience firsthand the conditions in various locations around our medical center, including the dedicated COVID isolation unit, the emergency department, and elsewhere. We're here today to represent concerns shared by healthcare workers across our nation. We are facing a novel virus, or new virus, of which little is known, but much is currently being studied. There is a growing body of research, but many of the results are conflicting. Ultimately, it is still too early to tell the potential or actual harm this virus can impose and how easily it can spread throughout our healthcare facilities as well as our greater community. Our medical center should be following precautionary principles where we don't wait until we know something is harmful before we protect against it. UCSF has been following weakened CDC guidelines that state simple face masks are an acceptable alternative protection for healthcare workers, but only in the context of not having access to more protective respirators. The CDC states, quote, "When the supply chain is restored, facilities with a respiratory protection program should return to the use of respirators for patients with known or suspected COVID-19. Other healthcare facilities in our area have committed to providing higher standard PPE to their healthcare workers. UCSF is a leading medical center across our globe and should not be lagging so far behind when it comes to implementing the highest standards to protect its employees, patients, and community. Ultimately, we are all ready and willing to care for and protect our patients in the face of this pandemic, but we can only do so effectively if we are properly protected to prevent potential transmission to our patients, families, and community. That's why we are here today demanding the highest standard PPE